Welcome to Medonic Laser Clinic. The purpose of this brief video is to answer many of the questions you have about laser vision correction that may be causing any concern in your mind. This is only reasonable, as with most people, you feel your eyes are your most precious organ.
The benefits of laser vision correction are understood by most people who experience the inconvenience of wearing glasses or contact lenses, but many questions remain unanswered. At Medonic Laser Clinic, our approach is to help you make an informed decision. We start with a series of thorough eye tests at a private consultation at your convenience that will last about 40 minutes. And you'll be encouraged to ask as many questions as you wish. For example,
has anybody ever gone blind following laser vision correction?
After more than 1.5 million laser vision corrections, there has not been one case of blindness reported anywhere in the world.
Will I have perfect vision or will I still need glasses?
Many of my patients achieve 20/20 vision. Others may have their use of corrective lenses reduced dramatically, where mild glasses may still be required for some reading, working at a computer, or night driving.
Will there be any pain?
Most patients will not feel any pain during the procedure itself. However, most patients experience some discomfort and a minor level of irritation, light sensitivity, and weeping for the first few days.
How long will the surgery take?
While laser vision correction literally takes only seconds, we ask you to allow around 2 hours. We can treat both eyes on one day, or if you prefer, we can treat them separately at times that suit you. The choice is yours, depending on your professional commitments and lifestyle requirements.
Who will conduct the surgery?
At Medonic Laser Clinic, all laser vision correction surgery is conducted by myself. It may be important for you to understand that as an experienced eye surgeon, I spent 12 years in full-time medical study at Melbourne University, including 3 years specialist study in ophthalmology, more commonly known as micro-eye surgery. Before entering practice, I spent a further year in New York as research fellow to Professor Miles Galen, one of the pioneers responsible for the introduction of intraocular lens implants. As a practicing doctor, I've spent a further 14 years conducting refractive eye surgery, including many thousands of successful laser vision corrections. If you need to know more, please find a more detailed medical biography contained within the patient notes we shall provide to you.
at the conclusion of our first consultation, we shall discuss the various types of laser procedure available to treat your eyes, given their unique state of health and condition. We shall also provide you with detailed patient notes, plus a video to discuss with your family or GP. This session is free. There's no obligation. Should you decide to proceed, we shall ask you to undergo a series of more thorough medical tests, where the health of your eyes will be thoroughly examined, measured, and accurately assessed for laser vision correction. This session will take more than 1 hour. We shall conduct computer topography of each eye, and then, through dilation of your pupils, examine the back of your eyes to further determine their exact state of health. You'll be encouraged to ask more questions. For example,
I've heard about LASIK. That's new, isn't it? And a laser called PRK. Has that now been superseded by LASIK?
This is one of our most frequently asked questions, and probably represents one of the greatest misunderstandings about laser vision correction. At first, we thought LASIK would replace the PRK procedure, but through invaluable experience, we soon learnt that it depends on the specific eye undergoing laser vision correction. LASIK is in the best interests of some patients, PRK in the best interests of others. There are two determining factors that decide which laser vision correction procedure will be best for your eye. If your refractive error is below 3 diopters, PRK is safest. Between 3 and 6, both PRK and LASIK are suitable. But if your refractive error is above 6 diopters or you suffer moderate long-sightedness, then LASIK is safest. Then there is another simple physical consideration. If your eye is small or deep set, we cannot manoeuvre the LASIK suction ring sufficiently close to your eye, so PRK is the safest. Essentially, there is no difference in result between the two laser procedures. But the PRK treatment requires that we gently sculpt the outer layer of your cornea, so healing takes a little longer. With LASIK and the microkeratome technique, we can fashion a self-sealing corneal flap and directly treat the third layer, so healing is quicker.
Well, is there a difference in pain between LASIK and PRK?
There is little or no pain, as we normally feel it. However, with LASIK, there is some discomfort during the procedure, but virtually none once the procedure is completed. With PRK, there's virtually no discomfort during the procedure, but most feel some discomfort for a short period after.
How soon will my vision be restored?
With LASIK, vision may be restored any time between 2 hours and 2 days. With PRK, normal vision usually takes 5 to 7 days. Usually, within a few days, there will be no difference between LASIK and PRK in terms of discomfort. We are treating your eyes, and it is critically important that we specify the laser vision correction procedure that will minimize the risk, no matter how minor. What is a few hours or even a few days of mild discomfort compared to improved vision and a new lifestyle with more flexibility, more freedom to do what you want for the rest of your life?
How soon can I get back to my normal routine?
If you have only one eye at a time corrected, you will most likely achieve legal driving vision within the next day or so.
I've heard about scarring. I think I may be a bad healer.
The LASIK procedure virtually eliminates scarring. If your eyes are not suitable for LASIK, in this case, we would not recommend laser vision correction.
What does Medonic include in the cost of laser vision correction?
Should you proceed with laser vision correction, one of our consultants will provide you with a detailed quotation and also explain the specific eye treatment required to correct the refractive error in your eyes. However, it is important to understand that we ask only one fee, and that fee covers all post-operative laser vision correction aftercare and any enhancement surgery that you may require. We call it the Medonic Care Policy. If it helps you, we can arrange finance and terms that you will be comfortable with.
At the conclusion of the topography session, Dr. Mark Medonic will determine the most suitable laser treatment for your eyes, and we shall provide you with a realistic expectation of your potential to achieve 20/20 vision. Unfortunately, you may even be told, as with more than 1/3 of our applicants, that your eyes are not suitable. At this point, you have made no payment, no commitment. If you have any doubts, you are still free to walk away. At Medonic, we want to help you to make an informed decision about laser vision correction and your eyes.